Hi, welcome to You and Your Family, Strengthening and Unifying Families. Bienvenidos a usted y su familia, fortaleciendo y unificando a la familia, con su amigo y servidor Celso Mesías, y muy agradecidos por su gentil sintonía. Queridos amigos, hoy día voy a empezar el programa trayéndoles algunas estadísticas que son ciertamente preocupantes y que nos ponen en medio de una crisis. Y es que quiero referirme lamentablemente en este problema a lo que está sucediendo no solo a nivel nacional en los Estados Unidos, sino también en nuestro estado de Pensilvania y aquí en el condado de Lancaster. Me estoy refiriendo a que más de 60,000 personas el año pasado, 2016, aquí en los Estados Unidos, murieron por una sobredosis en el consumo de drogas. De ellos, 30,000, más de 30,000, fueron producto de una sobredosis de, como en inglés se les conoce, por el consumo de opioids. Y lo que nos preocupa es que aquí en el estado de Pensilvania el incremento ha sido de más del 37%, y particularmente estas fatales o sobredosis que no solamente atacan a nuestros adultos, nos preocupa también que nuestros jóvenes estén consumiendo altamente y sufriendo las lamentables consecuencias de una fatalidad. Y es aquí, en el condado de Lancaster, que también nos encontramos con cifras ya ciertamente alarmantes, que respecto al año anterior crecieron o se incrementó un 45%. Este año tenemos que ya van alrededor de 98 muertes. Y el año pasado tuvimos un récord de 117 muertes a causa de este problema. Entonces, hoy día queremos llegar a su hogar, porque sabemos de que usted, si conforma una familia, tiene hijos, tiene nietos, tiene familiares, o como propios ya personas adultas, pasando con este problema, y que puede ser en muchos casos angustiante, no solamente para la familia, sino en su conjunto para toda la comunidad. Por eso, queridos amigos, hemos querido traer este problema que está tornándose en vital en cuanto a su actualidad y vigencia, y cada vez más preocupante, con la presencia hoy día de alguien que nos va abordando el tema, nos va a ilustrar mejor de esta situación y cómo se está tomando o su organización está contribuyendo en la solución de este problema. Es por eso que hoy día quiero presentarles a nuestro invitado. Today we have a very special guest, and he is from the Byrnes Health Education Center. And I would like to introduce the director of education services of this organization. He is Mr. James Reisinger.
Yes.
Okay. Welcome to You and Your Family.
And thank you
James.
for having me.
James, I took some time or minutes at the beginning of this program just to give the frame, or just an introduction of this concern that not only officials, health officials or police officers can take care this really crisis, because the deaths of drug overdoses is really a matter that is now is crucial, and it shows like or coming like an epidemic. So please explain a little bit what's going on about this issue.
Well, about 15 years ago, there was this movement among the medical community to eliminate all pain. So we started seeing more and more opiates being prescribed, large amounts, and what we have seen over time is that the opiates, or when prescriptions are running out and patients can't get refills, they are moving on to an alternative. And that alternative, which is a cheaper alternative, has been heroin. So it took years and years to get into this mess, and it's going to take years to get out. And it starts with education, and educating not only adults but young people about the power of opiates. We feel knowledge is power, and the more you know and understand about this issue, the better decisions you will make. But it starts with each one of us. You know, you can't just depend on the police to take care of the problem. This is a community problem, and we all need to work together because there are many angles and this is a complex issue. Where do you start? But in terms of the Byrnes Health Education Center, we believe education, prevention education, and we have to start talking to young people probably a little bit earlier than we're all comfortable with, but it needs to start somewhere because what we've been doing over the last 15 years is not working, and
Correct.
The statistics show that.
Exactly. Well, that is very essential and a key piece, the education, but we are going to talk about that later.
Okay.
Lo que nos estaba compartiendo aquí James es que efectivamente en los últimos 15 años ha imperado en las prescripciones médicas en cuanto al tratamiento del dolor una manera más fácil de cómo acudir o tener acceso a estos aliviantes del dolor, y muchos de ellos analgésicos o medicinas que son muy baratas como la heroína. Esa ha sido una de las tantas razones, pero hay muchos ángulos con los que, de donde podemos tener una información y que nos dé una idea más amplia de lo complejo que el problema es en el consumo y el abuso, y por ende las consecuencias fatales como son las sobredosis que están al alcance cada vez más de nuestros jóvenes. Y es por eso que su organización, enfocándose en cómo tratar de contribuir en la solución de este problema, es que han encontrado que en la prevención es una de las maneras como podemos atacar el problema de frente. So, it's certainly the truth that prevention here, education in health matters, especially for our young people, I mean students, elementary students, children that need to this access to this information. But what about the parents? You know, how they can also get this awareness about what's going on?
Yeah, it's you can't forget about the parents. It's important to educate the students, but we also have to educate the family. And you know, we need to let parents know to be good role models, and they need to monitor their own behaviors when it comes to taking medicine, and specifically painkillers and opiates, and you know, and they need to educate their children to practice those healthy behaviors. And you know, you can't just expect the schools to take care of that. We have to reach out to families as well in the community. At the Byrnes Center, we offer programs that include parents and their teens when it comes to drug use and heroin use. We do have programs that address that and educate the whole family on awareness, the issue. It all starts with your body, and if you want to know what drugs do to your body, specifically heroin, you need to know how your body works in the first place. And many adults don't understand the basic nervous system and how their body communicates with one another, let alone how drugs like heroin hurt their brain, their health, their heart, their nervous system, and other body systems. So we tried to start every program with a nervous system lesson, talking about their brain and how their brain works, and now how heroin and how other drugs impair the brain. So we have to do more when it comes to educating the moms and the dads or the caretakers out there, because students may hear one thing at school and then they go home and they see something different. So we have to make sure there's consistency.
It's the real world.
That's right. We have to make sure that there's a consistent message at home and in the schools.
That's right, James. Lo que nos está compartiendo James es que los padres, los adultos, no pueden estar ajenos a esta problemática, porque con la educación no solamente llegamos directamente, claro, a los estudiantes, a los niños o a los adolescentes, pero los padres o quienes se encargan de el cuidado, la crianza, la salud de los hijos, tienen que tener esta conciencia que no necesariamente van a adquirir esta buena educación en las escuelas, sino que en los hogares también encuentran lo que ven, así como también en las calles, y que pueden influir directamente a ellos. Es por eso que the Byrnes Health Education Center tiene esta organización una misión de cómo educar no solamente a los niños o a los jóvenes, sino también a los padres en estos problemas. Basically, I know that your organization, educational organization, has multiple programs, outreach programs, but I would like to focus in one, especially the heroin wake
up call.
Wake up all. And so please share a little bit about this program.
Okay. We developed Heroin the Wake Up Call a year and a half ago. And it was a result of the York County Heroin Task Force needed an educational component to what they were trying to accomplish in the county. So we approached the task force, and together we partnered, and we developed this program. And the program is 1 hour long. We take it out to middle schools and high schools, or for anyone, but primarily it was developed to take to the schools. And we address not only heroin, but we also address opiates, because not every adult knows what an opiate is, let alone a 6th or 7th grader. So we're going to tell them what is an opiate, and what do opiates do to your brain, and what is the connection between those who abuse opiates to heroin. What's that connection? And that connection is that they come from the same source. They come from opium. And opiates are basically going to do 3 things to you. They're going to make you feel relaxed, they're going to take away your pain, and they're going to slow down your breathing. And that's what heroin is going to do as well. So when an individual runs out of their opiates and they need, or psychologically or physically feel they need more, some move on to that alternative, which I mentioned earlier, is heroin. When people overdose from heroin, it's because their bodies forget to breathe. It slows down the respiratory system, and they will stop breathing. What is scary today is what's cut with the heroin, what the dealers are putting in the heroin, fentanyl, carfentanil. So
those are, excuse me, synthetic, I guess, obvious, right?
Well, fentanyl is a legal opiate that's used in hospital settings, and it's very powerful. They say it's 50 times stronger than heroin. So unknowingly, someone buying heroin on the street might not know the heroin's been combined with the fentanyl, and
This
they may stop
combination
breathing. They stop
makes
breathing.
fatal.
Yes, it's much more powerful. And statistically, in Pennsylvania, we're seeing just fentanyl-laced heroin just through the roof, and it's scary. And then they say carfentanil, which is used to sedate large animals like elephants. Now they're finding carfentanil in heroin, which just shows you how out of control this epidemic is getting, and how awareness and education is so important, because what you think you're getting might not be what you're getting at all.
Yes, and very sad. Lo que nos ha podido compartir James, y quiero decirlo brevemente por la extensión del programa, es que Heroin Wake Up Call es uno de los programas que tiene la organización Byrnes Education Center para cómo ir directamente en la educación a estudiantes de los riesgos y peligros que hay, primero conociendo su cuerpo y las consecuencias en el consumo de estos analgésicos o sustancias que son drogas que lamentablemente con la heroína y otras drogas sintéticas como you mentioned this substance, the combination with the synthetic opiates like
fentanyl and carfentanil.
And carfentanil. Ok, con estas sustancias es que hacen que la combinación sea realmente fatal y lo que produce finalmente la sobredosis y la muerte. Con los primeros síntomas de una falta total al bloqueo de las vías respiratorias, que no pueden respirar, y luego las consecuencias cardíacas y lamentablemente el fallecimiento, incluso ya clínico. We can also see, James, how this issue is taken seriously. Just the White House commission to the president highly recommended that to declare to a national emergency about this. Is that really, I can say dramatic, it's really a tragedy. That's what's going on.
Yes, it's this epidemic. It doesn't seem to be getting better. It seems to be getting worse. And if you look at the deaths, the overall drug deaths, whether it be by the county you live in, the state you live in, or the country, the numbers are going up, 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 not only in overall drug deaths, but the deaths related to opiates and heroin. I know here in Lancaster County last year there were 117 deaths due to opiates or heroin overdoses. And in York County, where the Byrnes Center is, there were, I believe there were just over 70 deaths. Those numbers have continued to climb each year over the last several years. Overall in the country, in 2015, we had approximately 47,000 drug overdose deaths. Well over half of those were related to opiates or heroin. 2016, that 47,000 went to close to 60,000 overall drug deaths. And they say over 60-70% of those are related to opiates and heroin. So this is a national epidemic. It is a national issue, and I'm not surprised that our federal government is now being asked for resources, for funding, for treatment, for addiction, and for prevention. We have to do something. It's not getting better, it's getting worse.
Exactamente. We mentioned those numbers at the beginning of the program, and that's a really very sad how could be also in just in our county here in Lancaster could be the trend, double the numbers if we don't stop this.
Right.
So, lo que nos ha compartido ahora James es que efectivamente el problema es muy serio y a tal punto de que hay una comisión especializada que en el combate a el consumo de opioides en los Estados Unidos, que ha recomendado al presidente que se declare una emergencia nacional, dada la gravedad del asunto y que las cifras cada vez están aumentando. So, James, we really appreciate the job that you are doing in your organization. I've just attended one of your events, and it's really very important how to get this awareness in the whole community. So you think that in the prevention is a really an effective action that you are doing, but recently also in this county they just formed and launched a very important initiative, joining forces how to attack this problem. In your county or in the 11th of Pennsylvania is doing something similar, or are you going to join also these forces?
Well, each county seems to, more and more task forces are being developed in each county. I think there are many angles at attacking this epidemic. Is it more education? Is it tougher laws? Is it more treatment, more resources, more addiction resources for those who have problems? All the above. So I think you're seeing more and more task forces, more and more communities recognizing the problem and trying to be proactive and taking an approach to stop it. So whether it be here in Lancaster County or York County, I know there are other task forces and groups in other counties getting together. I think that's all positive news, unfortunately, but I think it's showing that people care and people are trying to prevent this issue from getting worse.
Mm-hmm. And how can parents can involved and help or contribute to address this issue?
I think you need to, first of all, educate yourself on the issue, pay attention to what's happening in their area, whether it be through the media or whether it be through their own contacts and resources. Look for events that are happening, whether it be events at your child's school or programs being offered in the evening in your community. Be proactive, get involved, and pay attention, because this drug does not discriminate. And if you think it can't happen to you or your family, you're wrong.
Pay attention our kids, right?
Hey, even good people make poor choices, so don't ever say "not my child." So I think everyone owes it to themselves and their families to get involved and pay attention and volunteer. Show up to a town hall meeting. There are many town hall meetings, and call your local law enforcement. Ask them what events are happening that they can attend. Anything that you do can help. I know we're talking to students in schools to try to get them more active in discussing this issue. This is everyone's problem. This is not just a police issue. It's all of our it's everyone's problem, and we're trying to do the best that we can, but we can't do it alone. We need everyone's help.
That's right. So ya lo escuchó, estimados padres de familia. Necesitamos de cómo usted pueda también involucrarse con un mayor compromiso en cómo poder estar más cerca, no solamente a la escuela, sino también empecemos por nosotros mismos y por nuestros hijos. Es realmente un problema muy grave el que podríamos estar evitando. Finally, James, we know you have many programs and also the theater program. So just a little bit at the end, can you just share what services and programs do you have and how we can access to your services?
The Byrnes Health Education Center is located in York, Pennsylvania. We're at 515 South George Street. We have a website, www.byrneshec.org. We provide prevention education programs at our center. Schools will come to our center for field trips, and we have over 50 presentations and programs to offer, ranging from drug education to physical fitness to dating relationships, HIV, AIDS, puberty, nutrition, mental health, distracted driving, and we also have programs for adults and businesses. We also will travel and take our programs on the road. So we do many outreach, and we travel all over the 8-county South Central Pennsylvania region. We're also able to webcast our programs to anywhere in the world from our teaching theaters, so that's starting to gain momentum. And we also have an online curriculum in which teachers and families can sign up for and gain access to our online activities that educate the whole family as well. We've been open since 1995, so we're in our 22nd year of existence, and we've been a little bit of everywhere.
And well, ya lo escucharon, queridos amigos. Pues bueno, estos son todos los servicios y programas que se presentan a través de Byrnes Health Education Center. Con ustedes será hasta la próxima. Sí, con usted y su familia.